So, should you be bringing your gynae photos?
What is called a speculum, which is this instrument over here, and it gets placed inside the vagina and it is opened up like that.
If you have a discharge, do not be shy or embarrassed about the discharge because that's the evidence that the gynae wants to see. But all in all, the basics is just a plain simple shower.
Okay.
Hello everyone. Welcome to our first episode of Ziright Girls. I am Dr. Tembelihle Masina and I'm here with my co-host, Thalia. Introduce yourself.
I'm Dr. Thalia Isaacs. We're both gynecologists and we'll be talking about all things gynae related from a gynae as well as a girly perspective. Lihle and I are both moms, so we've been there and we know how you feel.
Okay, so today we're talking about something that's often daunting to a lot of women and girls out there. Today we're talking about your first gynae visit, how to prepare for it, when you should go see your gynae, and basically what to prepare before you see your gynecologist.
So Lihle, tell the audience, when should you be scheduling your first gynae visit?
Okay, so your first gynae visit should ideally be after your first period. So most girls will experience their first period between the ages of 11 and 14. Again, if a girl experiences their period younger than that, maybe you should just have it checked out by your gynae. Or again, when you reach the age of 16 and you notice that there's a delay in your period, maybe you should give your gynae a visit. Also, I'd feel that most women should at least have seen a gynecologist by the age of 21 just to establish a relationship.
Yeah.
Or also when you're considering being sexually active, so you can discuss your contraceptive needs and all sexual health needs for a woman who is considering sexual activity for the first time.
Cool. So Lihle, now I'm at the gynae. How do I express myself clearly so they understand what I am experiencing?
Okay, so a lot of people are often nervous when they are coming to the gynae. I always say to make your experience valuable, always write down your questions or concerns for your gynae and also have a clear idea of what you want the outcome to be. Your gynae will ask you specific questions, whether it's about your pain or your periods, and also other problems relating to your sexual health. Be open and honest about it because your gynae is there trying to help you.
Yes, guys. So remember, your gynae is there as an ally and a partner in your reproductive health journey. Our position is always to trust you and believe what you say. So please never feel shy or embarrassed to give us the details.
Should we bring in your gynae photos?
Maybe not photos. But what might be useful is a little bit more history. So what about medical history?
Okay, so yes, your gynae would also want to know all your medical problems. So it would help if you can name all the diagnoses, whether it's psychiatric or medical, and list all the medications that you are on, because some medications may actually impact your gynecological problem. And also, if you are taking other alternative medications, do mention this to your gynae because it may also have an impact on medications that you will use in the future or actually on the actual gynecological problem. Your gynae would also want to know all other operations that you've ever had in your life, whether it was as a child or it was gynae related or non-gynae related, because again, some gynae problems require surgical intervention, and it always helps to know any relevant surgical history that you may have. And is there anything else, Thalia, that you think your gynae may want to know?
Yeah, maybe like a bit of social history, like what do you do during the day? Are you employed? Are you a student? Are you a stay-at-home somebody? Smoking sometimes can impact the medications that we are able to provide you. Sometimes it is contraindicated. Allergies, I cannot reiterate how important allergies are to us. Sometimes it can be a drug allergy, sometimes it's a food allergy, sometimes these food allergies translate into drug allergies, like eggs or fish, for example. And if you're not sure if you had an allergic reaction or just a side effect, describe it to us and we can help you decipher it.
So, Thalia, what should one expect from the gynae exam?
So I always like to do a finger prick glucose because gynecology is very closely related to endocrinology, which is the study of hormones. So my gynae exam always includes a finger prick glucose. And then I like to go top to toe so that I make sure that I don't forget or leave anything out. So I will be palpating the thyroid, which is located in your neck. I like to feel along your clavicle for any lymph nodes over here. We do a breast examination, an abdominal examination, and then a pelvic examination.
Oh, you can just explain to the audience what does the pelvic examination entail?
Okay, so pelvic examination is looking at the organs externally and internally. So for external organs, we like to use what is called a speculum, which is this instrument over here, and it gets placed inside the vagina and it is opened up like that so that we can have a look inside the vagina, at the vagina and the cervix. And at this point, we'll be doing the pap smear at the same time. And then we take that out. Then we do an ultrasound to look at the internal pelvic organs. So those are your ovaries and your uterus. And that can either be done transabdominally or it can be done transvaginally. Most gynaes will probably want to do a transvaginal ultrasound because the pictures are clearer and the resolution is better because the transvaginal scan is closer to the organs than the abdominal scan.
Is it always necessary to do a pap smear when you visit the gynae?
So pap smears are indicated once you become sexually active. So if you are a virgin or you've never been sexually active before, then no, you don't necessarily need to have a pap smear.
Because a lot of people are actually scared of the speculum, and that's the part that they are scared of when coming to the gynae.
So chat to your gynae if you're feeling a little bit anxious. If you're feeling scared, nothing that we do is meant to be painful. So if you are feeling uncomfortable or any pain, that's the time that you say, speak up to your gynae so that we can try something else.
So, if a person is on their period, should they still come to see their gynae?
Yes, absolutely. Sometimes that is the problem that you need to discuss. Some people have irregular periods, and scheduling a gynae appointment around that might be impossible. Sometimes that is the evidence that we want to see of what the problem is. So please come even if you have your menstruation at the time. And also, if you found a gynae that's scared of a little bit of menstrual blood, then you found the wrong gynae. What about shaving?
So, shaving, I take shaving as a hairstyle. If you prefer to shave, then go ahead and shave, but please do not shave for the convenience of your gynae. However, if that will make you feel a bit more comfortable, go ahead and shave, but no gynae will judge you if you are shaved or unshaven. The least your gynae expects you to do is at least shower on the day before you see them. Maybe you should consider avoiding intercourse on the day or on the day before seeing the gynae because that may affect some tests that the gynae may want to do. If you have a discharge, do not be shy or embarrassed about the discharge because that's the evidence that the gynae wants to see. But all in all, the basics is just a plain, simple shower.
Okay, cool.
There you have it. Thanks for tuning in into our first episode of Ziright Girls. I hope we've given you some useful information and tips on how to survive and thrive at your first gynae appointment.
Thanks for tuning in. You can find us on TikTok and YouTube. Please don't forget to like and subscribe. And if you want us to address any particular topics, please leave it in the comments. So I hope that
Ziright Girls.